Welcome to the Prescription Strength Podcast. I'm your host, Dr. Lynette Hewitt, GP and personal trainer, bringing you health and strength without the hype. Thanks for listening. In this episode of the podcast, I'm talking to Dr. Claire Davies. Claire is a GP in Hackney, and she's also a coach working with female doctors to help them bridge the confidence and capability gap. We discuss the importance of being heard in the healthcare system and how both doctor and patient can work together to better navigate the healthcare system. It's a great conversation. I'm sure you'll enjoy it. I'm joined today by Dr. Ceara Clarke. She is a clinical psychologist who works in a large NHS hospital, helping people who've had a life-changing event or diagnosis. Ceara made the mistake of replying to one of my newsletters and suggesting I have somebody on to talk about acceptance and commitment therapy, or ACT as it's short, and how it helps people. So obviously I offered her the hot seat, and with a bit of arm twisting, she's here today to share how she uses this type of therapy to help people move forward with their lives. So Ceara, thank you for being here. It's worth saying from the outset that neither you or I have experienced a chronic illness or life-changing event yet. We're all patients at the end of the day, but we have both worked with people at different stages of this journey, and that's where the value of this conversation comes from. So let's start by you perhaps giving me a flavour of when you first meet someone in your role. They're probably in hospital because that's work. Where on earth do you begin?
That's a good question. So I suppose, just to give a bit of context, my work involves working with people who are outpatients, so people who've been referred to our service because they have a health condition, and we are there to support their psychological, I suppose, well-being, because as we know, when you have a long-term health condition, it does affect how you think and how you feel, and the mind and the body are linked. So I do some work with people as an outpatient basis, and they would come to see me once a fortnight, and we just try to help them to, I suppose, live a rich, meaningful life alongside an illness, because many of these illnesses and conditions aren't going to go away. There isn't a cure. They're having to live with it. So that's what we do. We also support people who are in hospital, who are inpatients, who are really struggling, maybe people who are feeling very, very anxious or very, very low, or are finding it a struggle to kind of manage the regime with their illness. So we pop down, and we call it psychological first aid. So it's like a light touch, 1 or 2 sessions of just sort of psychological support. And I was delighted that you did twist my arm. There was a lot of arm twisting, wasn't there? Come on to this podcast, because this isn't something that I do.
Oh, I can nag.
Yeah. So I don't do things like this. So I'm a bit nervous. But so we work, it really just depends, Lynette, I suppose is what I'm trying to say. Essentially, if you boil down to it as a psychologist, if you ask me, what is it you actually do? What do psychologists do? We sit with people, we hear their story, we try to help them make sense of some of the struggles that they're experiencing. Someone might come to us and say, feeling really, really anxious, I'm having panic attacks, I'm afraid to leave the house since I had a heart attack, or since I had a colostomy bag, inserted, or whatever the right medical term for that is. And I suppose lots of people come in and they feel a lot of shame, and they think, why am I not coping? Why am I feeling this way? What's wrong with me? And we sit with people, we hear their story, and we help them make sense of why they're feeling the way that they do. And then we offer psychological strategies, I suppose, to just help people manage it a bit easier. So it really just depends on the person and what they're coming for.
Yeah, if I could just give you perhaps a scenario that I'm imagining, perhaps things that I'm drawing on the times when I've worked in the hospital. Let's say somebody is in an accident. They don't really have any memory of coming into hospital, but by the time they wake up, they've got something permanent that's happened. Say a leg is missing. How might you open a conversation with that person who is absolutely horrified when they look down because they don't recognize what they see? Because I genuinely wouldn't know where to start, even though I've been in that situation, but I've been in that scenario where there's been so many other people around. It's not been on my shoulders to find the right words. And I feel that a lot of people assume there should be certain words they should say to make somebody feel better. So where would you, with your training, start with something as massive as that?
And reality is, Lynette, that there are no right words. to say. So it's not that because of my training, I've got it right and I can go down there, speak to somebody and make them feel better. That is not the case. I suppose what we do as psychologists and what people need at a time like that is understanding, empathy, is someone to sit with them and hear how difficult it is for. And sometimes that's hard for people, for patients who attend our hospital, to do with family members, because family members, they love you and they just want you to feel better. So when someone tries to communicate, I'm feeling really low, I don't know how I'm ever going to cope when I go home with my leg gone, I'm scared, I'm frightened. Family members will quickly go into practical mode and make you feel better mode. And they'll say things like, look, we'll manage, it'll be okay, you'll get used to it. Sure, at least you're still alive. And what people actually need at that point in time is just somebody to listen, somebody to empathize, and somebody to normalize what they're going through, and to hear their story and not try to jolly them along and not try to say the right thing. There is no right thing, Lynette, to say there, or no wrong thing. Losing a leg is an awful experience to go through.
What you've reminded me of there is something I've seen when I've had a family of patients and there's been a bereavement, a grief. And what I tend to observe is that everybody's trying to protect the other family member from their own grief. And what you were describing there in that interaction reminded me of that, because I would imagine if I had a life-changing event, my first thought might be, oh my God, they're going to have to look after me. I'm going to be a burden, and somehow we need to protect each other from all of that. I would imagine that's something you see evidence of quite quickly, would you?
Yeah. And it's a very lonely place. It's a very lonely place for the person who has had the life-changing event. If they feel there's no one I can talk to, there's nobody that can contain and bear my suffering, and often as well with, the medical team, nurses and doctors around, they get caught up in that as well. They find it very difficult. They're fixers. That's why they're in the job. They make people better. They put people's bones together and give them medicine and heal people. So when there's something that they can't do anything about, like take away someone's psychological distress, they can get into that as well, just not wanting to really go there. So suppose if I was to advise someone about what to do, it would be just sit with the person, just allow them to talk, try to contain their emotions. Don't be shocked. Don't rush in to cajole them and tell them everything's going to be okay. Allow them to express. They need to express their feelings. They need someone to hear their story before you can get to the stage of, right, what are we going to do about this and how are we going to make things better?
Yeah. And I suppose what might be worth alluding to is, if you are a family member, not to take it personally if the injured person or the unwell person can't quite share how they're feeling with you. And it may be because of the strength of that relationship that they're trying to protect you from the full force of their emotion. And maybe somebody a few steps back might, it's not that they're better, it's just that they're a bit more removed, would you say? And they might be a safer place to park some of that emotion.
Absolutely. And, when I go to see somebody, I'm an outside person. I'm there. This is my job. People don't have to worry about me and what they tell me, But it's interesting. It just reminded me of a woman I saw in the ward one time, and she'd had some of her the bottom half of her leg below the knee or above the knee, I can't remember, but half of her legs amputated, and she had been really struggling. She was referred to our service. We try to get there within 48 hours, as quickly as we can, but sometimes it might be a bit longer than that. And by the time I'd got to her, she was doing a lot better. So she'd come round from the surgery and she wouldn't look at her leg, and she'd kept the blankets up really tight. And the nurses and the physios and the OTs were saying, look, you need to do this, before you go home, we need to have you able to look at your leg, and, all the rehab type things that they were going to have to do with her. And she just couldn't. And it was actually the patients in the ward who really helped her. So sometimes you get that in wards, people helping one another. And she said, if it wasn't for Joe 2 beds down, I wouldn't be able to cope. When he came around, she had her curtain closed the whole time, didn't want anybody to see her. And he came over and he was saying, you need to open this curtain. Right, today we're opening it halfway. Tomorrow we're opening it another bit. You need to be able to do this. And, that peer support was probably more than I could have done, because that was someone with a lived experience. Helping another patient. It was lovely actually to see it. I kind of thought, I don't need to be here. It's being done
Yeah.
by the other patients.
Yeah, and I've said this so often in surgeries with patients, is that a good friend will be worth 10 times some official talking therapists or counselors, because it's that process of feeling able to say what you need to say without necessarily jumping in. And so I think when I've seen friends who are concerned about somebody that's close to them that's been hurt or injured or suffering, that actually just being there, like you said, is will do an awful lot. Don't underestimate your value in just being around. And
Yeah. And not being afraid to talk about the hard stuff if you can. It's a bit like grieving and bereavement. People avoid talking to people who've been bereaved because they don't want to make them sad.
yeah,
They don't want to make it worse. And when you do speak to somebody who's been bereaved, they will cry. But you haven't caused those tears. You've just allowed what is already in the person to be expressed. So you haven't made them sad. They're already sad. They've just expressed it with you because you've given them the opportunity to. And yes, a good friend is good. And I suppose when I meant peer support, I was thinking more about, people who have had this similar illness or the same condition. There are some big conditions that have peer support, and there are other smaller ones who don't. But it's just extremely powerful to talk to somebody who's been there, done it, bought the T-shirt, and really knows what it's like.
yeah. Yeah. Before we move on to the more interesting parts of ACT therapy, and I'll let you explain that is, I think it might be worth touching on the topic of self-blame when something's happened, because this may potentially happen with a road traffic accident. You may not necessarily know, but there are a lot of chronic life-changing conditions that people somehow end up feeling like they may have caused. I see this a lot with lifestyle related diseases, perhaps some of the fatty liver related diseases, diabetes to some extent, this underlying implication that exists that, well, this was preventable, therefore you must have done something. Do you see that in the early stages with people, or is that something that you have to work with people later on to unearth?
Yeah. I mean, it does. It's absolutely there. If you think about, if you look at social media and society, it's all about everything being perfect, isn't it? Everybody being happy, everybody being beautiful, everybody having a wonderful diet, everybody doing all the right things and nobody struggling. And that isn't real life at all. So we do, absolutely. I see it every day. And shame is a really toxic emotion to feel. It's different from guilt. Guilt is, I've done something wrong, I need to fix that or apologize for that. Shame is, I am wrong, and people do feel that a lot when they come through our doors. They think, I could have done something to prevent this. Maybe diabetes wasn't managed well. Diet, I work with people with PKU. Don't ask me to say the big long version of that, but but it's those sort of illnesses where your diet is really important. And if it was easy, Lynette, as doing everything that you're told to do, then we would all be perfect, wouldn't we?
Absolutely.
So
I'd have no job, you'd have no job.
exactly. Yeah, we'd all be out of work. But it's not as simple as that. There are many, many, many reasons why people aren't able to adhere to what their doctors have told them. And it's not because they're lazy. It's not because they're no good. It's not because they're not smart enough. It's complicated. It's really, really, really complicated. So I suppose that's where self-compassion, which is also part of ACT, is really, really important, because we know from the research that people who have self-compassion, who are compassionate about themselves, kinder towards themselves, don't beat themselves up, don't have this harsh inner critic always telling them they're no good. People who are more self-compassionate are the people who can make positive changes to their lifestyle, because they do it from a place of kindness and compassion. So when they have a day where they mess up, they eat all the wrong things, or they don't go to the gym like they said they would, they don't beat themselves up about that. They go, oh, do you know what? It's hard to be human. It's hard to fit everything in. I didn't feel like it today, but by God, I'll be there tomorrow. Whereas if you're harsh with yourself and you've got that really strong inner critic, then you're going to say, what's the point? You're useless. You knew you'd fail at this. You've never been able to stick to this regime. There's no point. Just give up.
Yeah, and I could talk for the rest of the week about the obsession with perfection, productivity, optimization, all of these things that it starts in school and it never leaves, and it drives so many of those behaviors. And it's just, anyway, that's a separate topic for another day. So let's get back to you, the bread and butter of how you work with people then to help them move on with a life-changing condition or illness. And you use a particular type of therapy, and it might be worth mentioning that there are various psychological therapies, and I tend to picture it like a big tree with lots of different branches and leaves and things, and some people will climb the tree one way and get where they want to go, and other people like others. But let's talk about ACT, because that's the specific type of therapy that you and your team are using. So give people a sense of really what it is.
Yeah, so ACT, I suppose ACT, it's tricky to talk about it on a short podcast, so this isn't going to be a lecture in ACT. This is really an introduction to the ACT model, and the reason why we use it in work, when it's particularly helpful, it's actually helpful for lots of different conditions, and I would even go as far as to say it's helpful just for humans in general. These are life skills that will help everybody with everything, because life is hard. Let's be honest, it's hard, and we're up against lots of difficulties and challenges. And, we have this tricky brain that that isn't as equipped to deal with modern day world.
We're stuck with.
Yeah. So you call yourself, you're a GP and you're a podcaster and a personal trainer and all the other things that you are. I'm a clinical psychologist, but really you and I are both hunter-gatherers, so we were born with a tricky brain. Many, many, many years ago, we lived in caves. You've probably seen the Flintstones, the cartoon, the Flintstones. That is us. That is how we lived. And it was extremely dangerous time to be human. If you look at us, we don't have, we're not able to climb trees. We don't have sharp teeth, claws. We can't run very fast. We're pretty useless, really, compared to other animals. And back then, there were lots of dangers: saber-toothed tigers, bears, mammoths, wolves. It was extreme weather. There was, food insecurity, disease, conflict with other groups. So our brains had to develop a way of keeping us safe, and that became the fight-flight response, which some of you may know about. So when we come up against danger, our body will prepare us to fight the danger or run. So if you think back to the cave, you go out, you're looking for food, you see an animal in the distance, you think, right, let's go, guys, let's get our spears and go and, kill this thing and bring it back and make some stew. And then you get close and you realize, look, that's really big, that animal. I think we're in trouble here, lads. Okay. So your body will immediately prepare you to fight it, hopefully win, bring it back, or run and survive. So we all know what that feels like. So this is when we're anxious or stressed, your heart's going really, really fast. That's pumping blood around your body to prepare you to fight or run. You'll start to shake. There's lots of adrenaline. You'll breathe a lot quicker and shorter, so that you're getting oxygen in. You'll even see athletes doing it at the start of a race. They'll go, they're getting as much oxygen in as possible to their muscles to run. You stop digesting your food, your pupils wide. So there's lots of things, your listeners can look up fight, flight response. It's all there.
And I think it's worth giving people example of, this is why you sometimes throw up in a moment of extreme stress. Your body hasn't got time to be digesting that food. So right, let's get rid of that and crack on with surviving.
Yeah, and you can run faster, you're lighter. And, so that is something that is innate. It's built into us, it's wired into your systems. And, the world has changed really quickly, so we don't need it as much. Chances are I step outside my door, there's no saber-toothed tiger or a wolf going to get me. But, the things that make me go into fight response are doing a podcast, for example. So my heart's going like this. I'm ready. Now, there's no actual danger. I'm just sitting in my living room. No one's going to fight me. But my brain doesn't know the difference between an actual threat and a threat that isn't there. So we experience these false alarms. So things like, going to a hospital if you're really worried about an appointment with your consultant, that causes a fight-flight response. Job interviews, having to speak at psychology conferences, sit in your driving test. We all know what that feels like. And it really is a false alarm, because there is no imminent danger to your life. But your brain and your body don't know the difference between the two. And it also affects how we think. So when we feel anxious, we have a tendency to think the worst. So we call it catastrophizing. And back in the day when we lived in caves, catastrophizing was a good idea because probably the worst was going to happen.
So there was a survival advantage to imagining the worst case scenario.
Definitely was.
Yeah.
So you're walking along, you step out of your cave, you're walking about, you're looking for food, you hear a noise in the bush beside you. You're better off thinking that's possibly a saber-toothed tiger, I'm out of here, than, oh, it's probably just a cute bird, I'll just ignore that and keep walking. You're dead. So we are still like that today, but the dangers aren't, as physically threatening. There are things like, socially, like me, for example, today speaking in this podcast, I'm thinking, oh no, this is going to go out. What if somebody I know watches it? What if people don't like it? It's about that sort of becoming a social, help me out with the words, the nerves are getting to me, I can't think.
So I think it's what you're describing is this very primitive response to a threat, and the need for us now to do a bit of a system update. I always use the computer analogy when it comes to brains, is that we need an updated operating system.
And we're not going to get one.
But
that's not going to happen. I wish if there was the one that could download, I would, but that isn't going to happen so we're kind of stuck with this tricky brain that isn't our fault, but we can work with it. And like I was saying, the dangers aren't necessarily physical danger, they're more social danger.
Mm-hmm.
So
but they feel real.
They feel absolutely real. But if you think about it, back in the day in the caves as well, we all lived in groups, clans and different groups. And, it was in your best interest not to upset too many people in that group, because if you were thrown out of that group, you were on your own and the chances are you're going to die. So, for example, let's use me in this podcast as an example. I'm worried about what if one of my colleagues hears this and thinks, oh, she's rubbish. That's about me not wanting to be put out of a social group. Do you get what I mean?
Yeah. And so I guess that's the key then, in that when you are changed by an illness or by some sort of medical event, how is my troop, how is my team going to receive me? And potentially there's your threat to your survival that's going on.
Exactly.
Would I be right
with
that? Yeah.
What are people going to think? What are my friends, my colleagues going to think about me? What if they think I'm less than I used to be? Or do they, all sorts of very unhelpful thinking starts to happen. And of course, so that makes people feel anxious. The fight-flight response feels horrible. Nobody enjoys it. So what people do then in order to cope is they avoid situations that make them feel that way. So people who I've met who have health conditions will tell me, Ceara, my life's got really, really small. I used to do this. I used to have a job. I used to be really sociable. I used to love going out. I would have chatted to anybody in the street. Everybody knew me. I was outgoing. I was doing all of these things, and now I just stay at home. I don't want to talk to anybody. I feel anxious when I set foot across the door. I only go to the shop at night because I know no one's going to be around. My friends have stopped calling me and asking me out to places because I always said no. And why did they do that? They did that because going out made them feel really uncomfortable. The fight-flight response. Yeah. And their brain's telling them, everybody's looking at you, everybody's judging you, so it's avoidance works. It reduces anxiety immediately, but what it does in the long term is it makes your life really small, and you're not capable of doing the things that you normally would do.
So somebody is meeting you in the outpatient clinic and they're describing that their life has gone from this version of them and this current version of themselves, and they've given you all these reasons why they're seeing threats everywhere. How do you work with them at that stage? I would imagine you explain what you've just explained, but what are the next steps in getting somebody through this to a position of acceptance?
I suppose for me, the first thing that I do is I normalize a lot of what people are experiencing. So some of the things people experience after a diagnosis or a health condition, or even something they've had from birth, but they're struggling with it, are, why me? That's a question everybody asks. Why me? We never think it's going to happen to us. What? And they spend a lot of time ruminating on that question, which isn't that helpful, because a lot of the time we don't know why them. It just is. It just is what it is. Yeah. It's completely human and understandable to think, why me? This is just something that we do. Fear and anxiety. What is the future going to look like for me? How am I going to manage this? How am I going to look after the kids? How am I going to keep my job going? How am I going to survive if I have to leave work? There's a lot of medical appointments, a lot of learning about the condition, side effects of drugs, a lot of hospitalization, and then navigating this tricky health system that we're all in. Where do you go for what? How do you get an appointment with your GP? It's tricky. It's a really tricky system to be in at the minute. There's a lot of loss involved in becoming ill or having arthritis, or, a loss of your identity. Sometimes people who are maybe used to being the breadwinner or the person who looks after everybody else, suddenly the tables are turned and they have to be helped. And that's a really hard thing to accept. Loss of this healthy body that they thought they'd always have, this future that they thought they would have that looked this way, now looks a different way. The financial impact I've kind of mentioned, needing help, guilt and shame, like we talked about before. Did I cause this illness? Stigma. Some illnesses and conditions aren't visible as well. So people think, why are they using a stick? Or, why aren't they able to do this, and this? Because on the outside, they look completely like they used to, like they always did. People becoming very depressed and anxious. I suppose on the positive side, we're talking here a lot, Lynette, about the difficulties and the downside to having an illness. Sometimes what I've seen as well is, especially a sudden illness really makes people think about what matters to them, which we're going to go on to talk about a bit more. But, a significant health event happens, and I see it a lot, especially in hospital, because I'm seeing the person immediately after the event has happened, and they're really thinking about what matters. I hear a lot of people talk about, relationships being really important, and gosh, I didn't realize how many people really cared about me. I've had lots of cards and people ringing me and asking me how I am and bringing me food, and sometimes I hear things like, I was working too hard. I was working so hard. You know what? Things are going to have to change when I get back to work again. I'm going to have to either reduce my hours, or I'm going to have to speak to my boss, take some of this off me. It's just not worth it.
So presumably this is all, this is part of your work. You're inviting people to verbalize these fears, these recognition of these stages,
and normalizing it,
normalizing it, yeah.
And saying, other people feel this way, other people think this way, this is how your brain works. There's a lot of psychoeducation.
Yeah.
And immediately what you can see that does for people is the shame reduces. The shame that you talked about earlier, it reduces. Because I don't know how many times, and even a couple of weeks ago, I went down to see somebody in the ward, and when I was explaining this very quickly, because it was just like an hour, one session, he said to me, Ceara, does everybody's brain work like this? Like, is this? And I said, yes. And I was shocked. I'm always shocked by how people don't know about this. But I suppose if you haven't studied psychology and nobody talks about the problems, then you wouldn't know. But, I was saying to him, yes, not only does my brain works like this, your consultant's brain works like this, your partner's brain works like this. This is a normal response to an abnormalish event that you haven't had a chance to prepare for.
Do you just reminded me of something I was chatting to a friend about. I'd had a new financial advisor out, and he was laying out all these things that we need to put in place for pension and and all of that boring stuff. And to him, those things are so important that why would we not be thinking about this and filling in forms and putting this all in place? And I have that same feeling when somebody hasn't paid attention to their fitness or their health. It's what you value, isn't it? And so, for somebody who's very focused on money and finances and investments, that's everything. For you, it's how the brain works. For me, it's perhaps, what you're eating and how you're training. And so we just bumble along assuming these things are of equal value to everybody. And of course they're not. And like you say, sometimes somebody reminds you with a bump that, oh yeah.
Yeah. And why would
people have got
how would anybody know how the brain works and about all the tricky, unhelpful thoughts that we have and all the feelings that we feel? Because there's also a huge stigma around struggle, especially mental health. I mean, everybody will talk about, oh, I broke my ankle and it's really sore and here's how it's fixed. But very rarely do people say, I had a panic attack this morning, or I haven't slept for 2 weeks because I'm just going over and over things in my head, or I'm really down. People aren't able to talk about that as they are with physical ailments, because there's a huge stigma.
The stigma is real. Yeah,
it's huge.
So There's a big part, I mean, the A in ACT stands for acceptance. So, and I think there's a crucial difference between accepting the reality of something and throwing your hands up in the air and just giving up. And I would imagine your skill set come into play here in that particular area of getting somebody to a point of acceptance, because, you know, you came in and you didn't have a heart condition and you're going home and you do have a heart condition and this isn't going to change. How do you work with somebody in that space to deal with the acceptance part of
and
that?
it's a tricky word, that acceptance, you know, and there's probably a better word that we could use. But acceptance, sometimes people think acceptance means just being okay with how things are, you know. So let's use a made up example of lots of different people that I've seen over the years. So someone has, I don't know, had a heart attack or some kind of heart event. And I'm not medical, so I don't understand. I know there's lots of different things, cardiac arrest and different things, and I don't understand them all. But a heart event, good, that's caused, you know, them to change their lives, and, you know, maybe they're getting out of breath when they try to walk up the stairs now, and they don't have the same energy, and they're tired, and they're frightened of causing another one. So the definition of not acceptance would be that person doing a lot of ruminating and thinking, why has this happened to me? I should have looked after my health better. I knew I was stressed at work. I should have, you know, cut down on my workload. You know, why has this happened to me? You know, I did everything right. Sometimes that's, you know, I looked after my health. I went to the gym and I still got this heart condition. You know, this isn't fair. I hate having this. I'm not going to be able to do all the things that I wanted to do, that I said I was going to do. They're all out the window now. You know, life is never going to be the same. I hate having this. I don't want anybody to see me like this. I don't want anybody to see all the weight I've lost, or how I've aged overnight, or, you know, how I can't take the dog for a walk without having to stop every 5 minutes and catch my breath. You know, this is awful. I absolutely hate this. And, you know, yeah, so that's a definition of not acceptance, isn't it? It's fighting it. It's getting angry, fighting with it. Acceptance looks something like this. You know, I don't like having this heart condition. This really sucks. My life has completely changed. Who would want this? I wouldn't wish it on my worst enemy. This is horrible. But here we are. Okay, so there's nothing I can do about what happened. What can I do now that this is the way I've been left? You know, so my GP spoke to me about joining a, you know, one of those groups for people who have had heart attacks, look at their exercise and their fitness and their, so I guess I could go to that. I wish I didn't have to go to that. I don't really want to. But here we are. Looks like I'm going to have to go to that. No, I don't know what caused this, but I have this heart condition. What am I now going to do with the rest of my time? So what can I do? I'm going to have to accept this is where we're at. But what can I do to help myself now and going forward? You know, yes, I wish I was still able to run up and down mountains, but I can't. You know, so what can I do? I might need to stop every 5 minutes when I take my dog for a walk, but I'm still going to do that. People might stop and ask me what's happened. Maybe I'll tell them, maybe I won't, but I'm not going to hide away in the house. This is the reality that I have to accept, and what can I do with it? So that's kind of what acceptance means. And it also means acceptance of thoughts and feelings. So the opposite of acceptance when you're dealing with tricky thoughts. So our brains will tell us things like, you know, your life's over now, Ciara. You've had this heart attack. People are going to be judging you. People are going to be thinking harshly about you. You know, people are maybe going to look at you and think, there's nothing really wrong with her. Why hasn't she gone back to work? Okay. So fighting with those thoughts goes something like this. Oh, now, come on, Ciara. People probably aren't thinking that. You know, it's really important that you get out there. That, in a way, I'm trying to argue back with myself. Okay, so I'm spending lots of time in my head, not doing the things that matter, because I'm in my head ruminating, arguing with myself. Acceptance in ACT is different, and it is, okay, thank you, mind. Thank you for telling me all these stories. I know you're trying to keep me safe. This is a survival mechanism. You think you're keeping me safe. So carry on there, but I'm going to go out and walk the dog and let those thoughts be there. And I'm going to experience anxiety instead of trying to deep breathe my way out of it or avoid taking the dog out for a walk because I don't want my neighbours to chat to me. I'm going to take these anxious feelings with me on my walk. Does that kind of make sense about where the acceptance piece comes in?
Yeah, absolutely. And that's quite a skill, I would imagine, to...
It takes lots of practice.
Yes, I was going to say, I would imagine you have to rehearse some of those messages. I think it's a bit like I've said to some of the clients I work with who've started off on a regime of lifestyle change and motivations flying in the first couple of weeks. And I will usually say to people, expect that to run out by about weeks 4 or 5. That's when you're going to have to find a different mechanism to commit to what it is that you're doing, but pay attention to the voice that comes up that tries to sabotage you. Oh, it's too cold to go out, or oh, I can't be bothered going to the gym. And it'll be different in everybody. And it's how you respond to that voice that decides which path you're on and you're going to stay on. So it's the same system at play, whether you're building a new life with a chronic condition, or you're building a new life out of a choice to build a different future. The mechanism underneath sounds like it's the same mechanism, really, I would say.
It is. I don't know if this is relevant or helpful or not, and if it isn't, you can cut it out. But, you know, a couple of years ago, as a psychology service, we decided to do the marathon relay, the Belfast Marathon, and we were in teams doing a relay. So obviously I had to do a wee bit of training for that. So I brought my gear into work and I was planning to go out for a run at lunchtime. So my gear was sitting there looking at me, and I'm already trying to think of reasons why I shouldn't do it. So I look out the window, it's raining. You know, there were a few people about to go for a walk. I can see them coming back because it's raining. I think, oh, if I go out there, I'm going to get soaked. My feet are going to be wet. My hair's going to get ruined. I also have plantar fasciitis. So if I go out there and run, it hurts. It's going to be sore. My mind was telling me things like, you know, people are going to be looking out the window, because this is in a hospital environment. You don't see people out running. You know, it doesn't happen. So people are going to...
Sadly not, no.
Yeah.
I'd like to change that, but that's another topic.
Change it, but no one ever joined me. So people are going to be looking out the window of their office thinking, look at that idiot. Look at her out running. Look at the state of her. You know, she doesn't even look like an athlete. Look at her thighs wobbling. You know, all of these reasons why I shouldn't go out. So this is a piece, and we know we're going to talk about it, where values come into it. So I kind of practice acceptance. These thoughts aren't going to go away. And I could sit in the office and I could argue back with them for 10 minutes and go, look, come on, no one's looking out the window at you, Ceara. People are nice. And sure, if they are, it doesn't matter. You know, I could sit, but I'm wasting time. We only get half an hour for a lunch break. So I'm just wasted 10 minutes arguing with myself. So it's the values piece of, why am I doing this? I'm doing this because, number one, I said I was going to do it, and I don't want to let people down. If I don't run this bit, someone else has to run 2 legs of the marathon, and I don't want to cause that suffering for someone. You know, it'll be good for us. It's good for my health. Running is good for you. We're all going to go for a pint afterwards in the bar in the Ormer Road where the marathon ends. And we were fundraising as well for the Trussell Trust, for the food bank. So, you know, we're raising money for people who can't afford food. So that's why I'm doing it. So am I willing to take the uncomfortableness, the thoughts that are telling me not to do it, and the feelings of embarrassment and sore feet and wet feet? Am I willing to take those feelings with me on the run, because they're not going to go away, and do it anyway? And that was a yes. So there's simple ways to kind of manage your mind that is going against you. Does that make sense?
Yeah, completely. And I think you tap nicely into this bigger piece of work, this bigger, really important piece of self-exploration and self-development, which is being clear about what things you value in life. And that's very much central to ACT therapy and how it works. I would argue anybody who's faced with change through circumstance, or electing to try and change their lives, taking some time to work out what your values are will make that path a lot easier to navigate. But it's a difficult thing to introduce to people if they've not perhaps had an exercise. So how would you start to introduce with a new client that you're working with this important piece of working out what your values are, because I think it's quite tricky to pin down.
It can be, but there are lots of Russ Harris, Stephen Hayes, they're the kind of the main sort of educators, the bigwigs. I was trying to think of a more technical term, but the bigwigs in ACT have written all the books, done all the courses, the research. They have very cleverly developed lots of different really simple strategies and exercises to get at what your values are. Because you're right, it's really hard. People don't sit and think about it. And, if you sit someone down and say, what's really important to you, what matters, they're going to go, I don't know. It's
getting that next episode of whatever it is. Yeah, you would think of just that really superficial stuff, wouldn't you? What's important next tonight or by the end of the week? But what we want people to do is zoom out and look at your life as a whole.
Yeah.
So.
And sometimes it comes up in conversation. People will be talking, and already I'll be thinking, well, relationships seem to matter to you. Being a good mum seems to matter to you. Being good at your job seems to matter. Being authentic, being truthful. So I'll pick up on people's values just by the conversation. But I suppose we're going to do a short exercise shortly, which is one that I use when I work with people. But you're right, motivation goes, very quickly. And I always say to people, I know we're leaving my office today, you're feeling, right, I'm going to do this and this. By the end of the day, sometimes that's gone. So what is going to keep you going? And that's the why. I know you use that term a lot, the why, the values. Why would I bother putting myself through the pain of going out and getting soaked, of having sore feet, of, saying no to birthday cake and yes to oatmeal? Why would I suffer like that? Well, it's your values, isn't it? And values are the things that give life meaning. And the research would suggest that people who are not necessarily happy, because life isn't about being happy, is it? Loads of hard things. It should never be a goal to be happy, because that's impossible. But meaning.
Yeah, it's fleeting. It's like motivation. It comes and goes, happiness. I think peace of mind is a better thing to strive for.
Or Russ Harris and all those bigwigs talk about meaning and life. A rich, meaningful life should be the goal. And, research has shown that people who lead a rich, meaningful life, so who behave in ways that are in line with their values, tend to do better psychologically than people who don't. Values are the things that give life meaning. They're the who we want to be and the what matters to us, the characteristics that we want to embody. They're not the same as goals. So, for example, health might be a value. I want to generally be able to walk places and lift shopping bags and do gardening and be able to run after my kids. Okay, so that's a long-term goal. You'll never get to the end and think, I've done health now. Check it off my to-do list. Done. Next. Health is a direction. In a compass, it's like going west. Now, there are goals, small goals on the way to health, like drink more water, go for a walk at lunchtime, make a breakfast, don't eat the fries from the canteen in the hospital. Can I also say, why are canteens so unhealthy? In hospitals?
Oh, don't. Again, there's another podcast episode in that.
If you want to be healthy, it's very hard. A banana is about the only thing I can get in the canteen and work that's healthy. But anyway, I'm gone off on one. So we'll do a short exercise.
Yeah, let's do that, because I imagine people are thinking, okay, right, I like the idea of this, but where do I start? So
really simple. As I said before, there's lots of different exercises that you can do, but one that I like is imagining that it's your 90th birthday. Okay, so I want you to do this, Lynette, and your listeners as well. So imagine, fast forward, that you're 90 and people are throwing a party for you, and all the people who've ever mattered to you are there. So, and even some people who may have already passed away, it's by magic, they're able to be there for your 90th birthday. Someone who's really important, you gets up to give a speech about you, and, they're going to talk about who you are as a person. So not all the things that you've achieved, like, well, maybe some achievements might be in there, she got a medal at running, or, she's a great grandmother or something like that. But more about the type of person you are, what you stood for in life, how you conducted yourself, what you did with your life that really mattered to them or had an impact on them. So this isn't what you want people to say, but what you would, this isn't what you think people would say. This is what you would really like people to say about you. Okay. So just taking a minute to think, what would I want people to say about me?
Yeah. And when I did this the first time,
Mm-hmm.
I found it easier to imagine what would horrify me if they
Mm,
said.
mm-hmm.
So, for example, if somebody stood up and said, well, she did the complete opposite of what she said she was doing all along,
Yeah,
I would be horrified.
yeah,
Okay, integrity is a very
important.
strong value for
Mhm.
me. Doing the right thing when nobody's looking is really
Yes,
important to
yeah,
me. And health, I would hope at my 90th party people are going, she's done all she can to keep herself
yeah,
healthy. That
yeah,
is very central to who I am.
yeah.
Uh, but yeah, I think it's a couple of things like that. But sometimes working out when perhaps a relationship's not gone very well or a friendship's ended, I've looked back on that and gone, so what was it about that? And that also helped me to go, okay, that person wasn't honest. They didn't show integrity. They weren't trustworthy. Actually, I realized those things are really important to me. And they're part of my values. So I've done this several times, and I seem to end up with the same few things every single time. But they're unique, aren't they? They're unique to each
They are.
individual.
And that's really important, that it doesn't become about the values that your parents bestowed on you or the values that society tells you need. Or, like me, I work in a trust. We have our core values of the trust that I work in, so it's about your personal values, what really matters to you. And that's a brilliant example. Another useful exercise is to think about somebody who you really admire. It might be somebody who you know, or it could be somebody who's really famous who you don't know. Well, what is it about them that you really admire? And those are things that obviously are important to you. It tells you a bit about what your values are. Or think of someone who you really dislike. You can't stand everything, and then you'll go the opposite. Well, if you hate them because they're really untrustworthy, then trust is obviously important to you. So there's lots of different ways of doing this.
So if somebody's done that exercise and perhaps they come back to you for a follow-up session and they say, yeah, I've been thinking about my values in the last couple of weeks, and I realize that being a reliable person or being a trustworthy person are really central to who I am. How might you help them to draw on that to move forward with their new illness, their new identity as a heart patient or a cancer patient?
So what I love about ACT is it's very, very practical. So there are practical strategies and tools, and they're only useful when people put them into practice. So I know a lot about ACT. I've read all the books, I've done all the training, I've done all the courses, know a lot about it. But see, if I don't practice it, it's useless to me. There's no point in me having all this knowledge if I don't actually put it into practice. So suppose it's when people are able to get down to what their values are, and I hear a lot from people saying, well, I really value my relationships, or I want to be back to a bit of the old me. I know I've changed. I know I can't do what I used to do, but I used to be outgoing. I used to talk to people. I used to like being around people. And now I'm in this shell, and, it's very hard to get out of it. And those things were very important to me. We'll say, okay, so relationships are important to you. Right. Okay. Well, let's break down. If you were to say, for the next month or the next week, I'm going to behave in ways that are in line with that value, relationships, what would you be doing? What are the actual behaviors that would mean that you're living that way? Or I'd say to them, if I was a fly on the wall, how could I guess what value you were working on this week? What would I see with my own eyes if relationships were important to you? So it might be things like, well, you'd see me picking up the phone and talking to my friend who I haven't had a chance to speak to yet because I've been so busy, even if it's only for 10 minutes. Or you'd see me actually stop doing the laundry and go and read my child that story. Or you'd see me actually look at my husband when he walks in the door and make him a cup of tea. Or, things like that, things that are important that bring you towards specifics. Exactly.
Specifics.
And we'll say, okay, right. So let's get about 20 things, 20 behaviors that are in line with that value. And then we'll rank them from easiest thing to do. So making a cup of tea for your husband's not too bad. But perhaps, at the end of that scale might be, writing a letter to a friend who you've lost touch with and you really want to reconnect with them, or you need to apologize over something, or, that would be a difficult thing to do. Or book a flight to Australia to see your sister. That involves a lot of planning, a lot of finance. That's a hard thing to do. So we look at the small things, and I'll say, okay, we're starting out really small. And this is important in ACT. You've got to start really small, achievable, smart goals, smart, achievable, I can't remember the measurable time specific.
Measurable, time
So
bound. Yeah.
I'll say, okay, pick one thing that you can do within the next 48 hours. So, and then we say, okay, every day I want you to do, or between now and 48 hours, I want you to engage in one of these behaviors. You choose which one, but it needs to be in line with your values. And that's how we do it. And then it comes the interesting part. So people come back to me the following week or 2 weeks later and they, Ciara, I didn't actually do the behavior. And then I love that. And I go, brilliant, brilliant. That's what we're here for. And they think they're going to get told off. They think they're going to say, you know, black mark against your name, you're in detention. No, I'm delighted when it doesn't work, because this is when the ACT skills are so useful. So I'll say, okay, what went wrong? Tell me what went wrong. Well, I forgot. There's usually one. Easily done. Life's busy. We do forget. Or, you know, well, I thought about picking up the phone to my friend, but then I just, you know, I was thinking, you know, what if she's fell out with me? What if she's angry with me? What if, you know, she's not interested in me and she's moved on and, you know, she can't be bothered, or I'm going to feel really awful if that happens. And I went to ring her and then, you know, I got really anxious and, you know, I just didn't. And then I put it off. I said I was going to do it tomorrow and I said it, and that happened every day and I just didn't do it, Ciara. And I'll go, right, brilliant. Your brain works the same as mine, same as everybody else. Thoughts and feelings got in the way.
You're back at that same part of the circle then, as to going, oh, remember we talked about this? This is what your brain would do, and it would put all these barriers in the way. Okay.
Yeah. So what can we do next time? So this is something that's really important to you. So we're not going to let this one go. You've thought about it. You've been in mental turmoil about it. You've ruminated on it. It must be important to you. So let's really prepare for another chance at having a go at this. And we know what's going to go wrong. Thoughts and feelings. It's always thoughts and feelings. We are wired to root. We're not lazy. Our bodies will always avoid anxiety. It works. You know, you go into a stressful situation, you feel anxious. If you leave, anxiety's away. But it's a short-term gain, isn't it? Long-term, avoiding things causes problems. So we'll say, okay, so there's so many strategies in ACT for dealing with tricky thoughts and tricky feelings. So one of them is to get space from your thought. So we'll say, okay, let's think, what are the thoughts that are going to come up for you? Well, she's not interested. She's so angry with me. She'll never speak to me again. I'm going to feel really awful after this. It's going to go horribly wrong. And I'd say, okay, what is a thought? It's literally words, isn't it? You know, a thought is words coming out of your mouth. You know, your lungs are involved, your tongue is involved, you know, your mouth, or it's an image. Sometimes we get images, don't we, of making the call and the friend shouting at us, you know, or the worst case scenario. So we just try to see those for what they are, which are thoughts. And it's not about, is the thought right or is it wrong? It's, is this helpful and taking me towards what matters? So really useful, really useful way to do that is we call it thought diffusion. Sorry to get technical on you, but it's literally just getting space from thoughts and seeing them for what they are and not allowing them to influence what we actually do. We can't control thoughts. We can't control feelings. The only thing we can control is what we physically do. All right. Our brains are always going to be wired to catastrophize and give us loads of reasons why we shouldn't do something hard. And we're never going to enjoy anxiety, and we can't control it either. So quick experiment for you and your listeners, if that's okay, won't take too long, is to think about a thought that really gets in the way of you doing something that matters to you. So for me, that thought would be, you're not good enough. You know, you're a rubbish psychologist. You're not good. You don't know enough. Not good enough.
Yeah, mine would be. I've struggled to make myself do stuff that I find boring. Well, because if it's not boring, I'm not growing, and growth is one of my values. So, but there's some boring stuff that I just have to do, but that gets in the way.
So what would be a typical thought? I don't want to do this. This is going to be really boring. That kind of thing?
Yeah.
Okay. So I want you just for 5-6 seconds to really fuse with that thought, okay? This is boring. I don't want to do it. I'm probably going to get distracted anyway and do something else. You know, so this is really boring and I don't want to do it.
And it's getting in the way of stuff I'd rather be doing.
Yeah.
That's the problem.
So that thought, this is boring. So I want you to put your hands up to your face, cover your eyes, Lynette. Okay, so imagine that this is you completely fused with that thought. Okay, so you can't see me anymore, can you?
No.
Would it be difficult to make a cup of tea for yourself with your hands up to your face like that?
It certainly would.
Yeah, it'd be hard to do the things that matter. And this is what happens when you're fused with thinking. It's all you can see. Okay, so
Can I take my hands away?
no, not yet.
Oh.
So I want you to get really fused with, this is boring, I don't want to do it. Okay, so saying that in your head, this is boring, I don't want to do it. Okay, now I want you to move your hands a bit further away from your face. Okay, so yeah.
So I've got a couple of centimeters gap.
Yeah, or you could have even more if you wanted.
Okay.
And I want you to, instead of saying, this is boring, I don't want to do it, to say, I'm having the thought that this is boring and I don't want to do it.
Yeah, I'm having the thought that this is boring. I don't want to do it. It's getting in the way of better stuff.
I'm having the thought that this is boring and I don't want to do it. Okay. Now I want you to put your hands on your lap. And I want you to, so they're still there. The thoughts are still here. And I want you to put another word in front of that phrase. I notice that I'm having the thought that this is boring and I don't want to do it.
Yeah, I notice I'm having the thought that this is boring. It's so less disabling,
isn't it? And now they're still here. So your hands, your thoughts, and they're on your lap. They haven't gone away. We haven't argued with them. We haven't got caught into a trap of talking yourself into it, or we haven't got rid of them. If there was a way, Lynette, that I could tell people to get rid of their thoughts, their negative thoughts and their unhelpful thoughts, I would share that with them. And I'd be delighted. I'd be using it myself, but there isn't. Okay, so the thoughts are still here, but you've got distance. Now you can see me. Now you could make a cup of tea if you wanted. Now you could, pay attention to the things that matter. So it's thought diffusion. It's not about getting rid of them. It's about taking them with you and doing the things that matter. So it's just one simple strategy that can be so powerful.
I think what it's showing me is that this same system can be applied to something really small that's just getting in the way and stopping you from meeting deadlines or tidying your house or all that stuff that probably isn't of huge consequence in the greatest universe. But the same system can be applied to something that is completely life-changing. Moving forward with a life-changing diagnosis, the actual tools and the skills underneath work with no matter what the size of the problem.
Yeah. And it's the same with feelings. So it's that the acceptance piece there is accepting that these thoughts are normal and we're always going to be there. We're not going to get rid of them. Accepting them, allowing them to be there, but getting a bit of space from them. And there's lots of different strategies. Russ Harris, Stephen Hayes, all those big wigs, and there's other ones as well. And they've all developed really brilliant, easy strategies. A favorite of mine is to thank your mind. So when I hear that I'm not good enough story, that's constantly there all my life, it's never going away. I don't care what cards I get from people saying you've really helped. I don't care how good my boss said I've done. If I won the Nobel Peace Prize, I will still have that thought. You're not good enough. You're rubbish. You don't know what you're doing. So I will just do a really simple diffusion technique, and I'll say thanks. So I'll say this inside. I'll not say it out loud unless I'm somewhere where there's no people. I'll say things like, thanks, mind. Thank you. There it goes again. I know you're just trying to protect me. So that's what it's trying to do, is trying to get you away from danger. Thanks for trying to protect me, but this thing is really important and I'm going to do it anyway. So you can stay there with me and you can come with me into this psychology conference, and while I'm walking up the steps and I'm shaking inside, and I can still actually speak. And I make room for the feelings. So I used to think I had to get rid of those feelings, and I had to, before speaking at a psychology conference, I had to deep breathe and try to get those feelings down. I don't anymore. I just accept that they're part of the fight-flight response, and I take them with me up to the podium. And, I'll maybe use a grounding strategy, which we're going to do later on if we get time as well. Does that make sense?
Okay. And I think what you're essentially doing then is letting people off the hook with trying to eradicate something that's a nuisance and just finding a way of living with it rather than, battling with it day after day after day, which I think is what's so exhausting for people. then you've
Yeah,
got no
and there
battery
was a
left for
stage where I
anything.
got into a brilliant routine, Lynette. I mean, I value health, always exercise, but like everybody, sometimes I fall off the wagon here and there. Things happen, you just fall off. And I remember there was a stage where I had just got into this groove, and it was fantastic. Waking up every day, 5:45. The trick for me was not letting my brain start thinking. The trick for me was get out of bed right away. Do not press snooze on that alarm. Once I press snooze, my mind will say, "Oh, it's cold out there. You could do it tomorrow. Do it tonight when you get home from work. It's too early. Who gets up at 5:45 to exercise? Don't. It's fine. Everybody else is in bed. The trick is not letting my mind get in the way." And that was brilliant when I had that routine. I just got up straight away before my mind could give me reasons not to, before my body could feel tired and want to stay warm and cozy in bed.
But I think you allude to another really important point, is that it's quite normal to fall off of a good habit sometimes. I mean, this is life. This is the weather of life, in that sometimes it's easier because, especially, as women raising kids and running jobs, sometimes life does demand that you have to put your energy elsewhere. And so it's not a moral failing that a system that worked really well 3 years ago may not neatly fit into your life at this time. And again, managing that inner critic that goes, well, I've done all this before. People do this with weight loss all the time. I was able to do it and it all came back on. I must be dreadful. Actually, life has moved on. Life has changed. And that's the self-compassion part of going, okay, don't beat yourself up about it.
And we're cave people. So
Mm.
back then, food was scarce. You never knew when you were going to get your next meal. So, I call it the seafood diet. Seafood and eat it. We're designed to see food and eat it. The problem is the world is different now. We have food all the time. My cupboards are stocked with food. I can phone and food will come. So it's very, very difficult to keep a handle on that.
Yeah.
Do you know what I mean?
And I think I've enjoyed that show with Dr. No that's on one of the random Sky channels, the bariatric surgeon in Texas who operates on very, very overweight people. And he's quite brutal at times with his patients about what they should and shouldn't do. But the reality is, when you see a glimpse of these people's lives, is that the environment they're in is not conducive to what they're wanting to achieve. And, I've no doubt if you took those patients and put them on a desert island in a completely different environment for a long period of time, then of course things would change. But that's not realistic. That's not working with reality.
And there are so many factors that get in the way. Poverty, healthy food is expensive. It's a lot easier to go into, look at the pound shops now. You can't even buy one bag of crisps. You're buying a 10. It's cheaper to buy a 10 pack of crisps for £1 than it is to buy one bag of crisps. The food companies are hope I'm not going to get sued now, but there are certain companies.
No, slag them off.
Good. That make food addictive. They put things into Pringles so that once you pop, you can't stop. Remember the word for Pringles? It's true.
Yeah, because it's about commercialism, and that is the reality of the commercial world that we live in. That's very consumerist. It's there to make money. It's not there to value your health. You have to kind of find a way to navigate that. So it's
and
very
that's
difficult.
not our fault. And berating ourselves and getting so self-critical is only going to make matters worse. It's actually you're going to be more likely to make important changes in your lifestyle if you can learn self-compassion. And there are lots of websites, Kristen Neff's website, Paul Gilbert, Compassion Focused Therapy. If you have a look at their websites, you can learn more about it, and they're recorded, guided kind of practices that you can do. And our brains, again, they're designed to kind of travel between past and present, aren't they? We're very, very rarely in the now, in the present moment. So if you think,
we're always catastrophizing.
And we're always thinking about the past or planning for the future. And again, in caves, that was a good idea, to learn from your mistakes and prepare for the worst. Nowadays, it isn't. And you could be watching a film and you could have a whole box of Pringles eaten without tasting them, without even knowing that you've ate them. That happens all the time, doesn't it? You're driving. I know we shouldn't drive and eat, but, and before you know it, that bag of minstrels is gone, because you haven't paid attention to the here and now. So within ACT, we learn how to be a bit more present. And a really helpful strategy that Russ Harris developed is, he calls it dropping anchor. So if apparently I've never sailed a boat before, but
Me neither.
if you good, so if you're in a boat and you're going into shore and a storm happens, the first thing that what would it be, the captain of the boat, the skipper, will do is let down the anchor. Now that doesn't stop the storm. The storm's still happening, the wind, the rain, the boat is going like this and this and this, but it's not going to get swept away because the anchor's down. And so thinking about emotional storms, you're in hospital or you're in the supermarket and you're having a panic attack, you can use the drop-in anchor strategy to just bring yourself back to the here and now. And it's so simple, and you've probably already heard of it, Lynette, but it's called using your 5 senses, 5, 4, 3, 2, 1. You stop and you pick 5 circles, 5 red things in your environment, 5 squares, and you look around you and you pay attention. So you're getting out of your head. You're stopping that ruminating of, oh God, I'm in a supermarket, I'm having a panic attack, everybody's going to see me, I'm probably going to faint, they're all going to be looking at me, I'm going to lose my mind. You're getting out of that and you're going, 5 red things. Well, there's one. There's a decoration on my Christmas tree. There's a book with a wee bit of red in, and you do that. And then you go to 4 sounds and you identify 4 sounds. So they don't have to be pleasant sounds, just sounds. So you're in it. Noticing, you're in a supermarket. Well, there's a child crying. There's the whirring of the freezers. There's the till going ping. You're just identifying them. 4 things that you can touch. So you can feel your scarf. You can feel your feet on the floor. You can feel the cold air of the supermarket. 2 things that you can smell. It could be a horrible smell. You can smell your own perfume or the aftershave of the person that just walked past you. And then 1 taste. And it might be the taste of the coffee you had this morning. But all you're doing there, you're not stopping. You're not stopping the weather. You're just steadying yourself in an emotional storm. And it's one of the most practical and helpful strategies that I share with people that really, really, really helps them.
That's really useful. I haven't come across that before. I've heard occupational therapists talk about the need to use your other senses to get out of your head. I have that actually in one of I've got an email series on stress, and it's the theme of one of them of actually using smells. But that strategy of the 5, 4, 3, 2, 1, I love that. I think that's absolutely fantastic. It's a really valuable, simple tool that anybody can use.
Anybody can use, and it's really helpful whenever I go down to see a person in a hospital. I mean, it's hospital environments are a really hard place to be. You're ill, something's happened, painful procedures are happening. You might be on a ward or in a room by yourself. You've got nothing to distract you. You're on your own. You're just in your own head. So what do our brains do? Catastrophize. That's all they do. Ruminate, ruminate, and ruminate. And it can be and it makes people feel really anxious and they can't sleep. The hospitals are noisy anyway. But when your mind is worrying, you're less likely to be able to sleep because the flight response gets activated. So it's a really simple thing to do in a hospital room. It's a simple thing you can do when you're out for a walk. You can literally do it anywhere. Nobody knows that you're doing it. So it's not like you have to sit down and get into a yoga pose to do it. You can do it sitting in a meeting. You can do it anywhere. And it doesn't stop. It's not going to make you suddenly calm, but what it will do is kind of break that cycle of ruminating and help to anchor you, ground you while the emotions are around. Does that make sense?
Brilliant. Yeah, I love little practical things that are easy to share that people can keep in their toolkit, because I just see a lot of getting the best out of life is just building out your toolkit and remembering, like you say, the practice helps with the remembering that, oh yeah, somebody suggested I try that, but I completely forgot it existed, and coming back to what's in your toolkit at times, so that you can live that rich and meaningful life that gives you peace of mind and not the Instagram life that everybody tries to convince you is the only one worth living.
It's about taking action. The strategies in ACT are about, accepting uncomfortable thoughts and feelings are part of doing anything that matters to you. Trying to get a handle on your tricky brain, your thoughts, diffusing from thoughts a little bit, accepting the feelings and committing to taking actions to do the things that matter. So you need to know what your values are, first of all. What are my values? And the things that get in our way are, we take our thoughts too seriously. I've mentioned that, avoidance, short-term gains. So, you know, having that slice of cake gives you a lovely feeling, doesn't it? At the time, it's tasty, endorphins are released, you know, the sugar hits, lovely. Short-term, lovely experience. Long-term, it's going to mess up your sugars and put weight on. And, you know, so it's, I kind of say to myself, what would my future self thank me for doing today? You know, so that involves going out for a walk at lunchtime, making something for dinner instead of going for takeaway. You know, my future self will be glad I did these things. It's about long term, you know, trying to get new habits and procrastinating. We put things off, don't we? Like the boring tasks, you know, so it's managing your mind and getting those things done and out of the way. So I'm just looking at my notes to see if there are other things that we were going to talk about. Is it okay to mention about the story about ourselves, Lynette? Have we got time? Or
Yeah, go ahead. Yeah. No, go ahead.
I mean, it could get technical. It's called self as context and the observer self, but really, you know, those are fancy words for very simple things. Sometimes we have an idea about ourselves, a story about ourselves that becomes very rigid. So we say things like, I am the type of person who can do X, Y, and Z, but I could never do that, you know, or I'm a shy person, or I'm the sort of person that looks after everybody, or I am ill, I am weak, or I'm not good enough, you know, my one that I have, you know, about not being good enough. And we get very, very wedded to those stories and very rigid about them. You know, and I work with lots of people who might have to give up their job, maybe something else, or not work at all because they can't, you know, and they feel very much like, well, I used to be a GP, or I used to be a dinner lady, or I used to be a teacher, and now I'm not that. Who am I? You know, maybe I'm not worth.
I see this among doctors. Yeah, I see this among doctors.
Very
a lot.
wedded to that part of us, and it's. I hear a lot from people. The old me, you know, I was doing this. I had a job. I was, you know, I was able to go out with friends. I was going on holidays. It was, you know, this old self. And the new self, they'll say things like, I can't do any of those things now. You know, I'm not going out anymore. I can't even work anymore. You know, I'm a burden to my family. Okay. So they idealize this old self as being perfect. I'm sure it wasn't. And that now is awful. And I'm sure there's some good things about now as well. So I try to help people mourn that loss of their old self and accept the situation where they're at now. So it's not saying accept and give up. This is your life. It's crap. It's always going to be crap. It's this is where you are now. You cannot change this illness, but what can you do? How do you live a rich and meaningful life alongside this illness? So it's about trying to loosen that story, and it is just a story that we have about ourselves, and getting a bit of distance from it. I was going to chat about a person I worked with, if that's okay. So I got permission from this person, and I've changed details to anonymise them as well. I'm not going to mention their name either. So this is a man in his 50s who would have described himself to me as quite a masculine, kind of tough guy. And Northern Ireland, you know, it would be, you know, quite strong and hard. We call them hard men in Belfast. Yeah. That's the term that we use. You know, he had lots of children. He went to work every day, provided for his family. He's kind of a well-known person in the community. He would have helped people, you know, pensioners down the street. He went out and built things for people. And, you know, if your plumbing went, he sort of man could turn his hand to anything. He could fix your leak if you had one. And he also said, you know, nobody messes with me either, you know, because I'm tough and I have this kind of presence and persona. And he used to love to walk his dog. And then he had 2 heart attacks, and overnight, Lynette, life just completely changed for him. He had to give up work. He said, I can't even walk to the end of my path without getting out of breath. I've lost about 3 stone. I've aged overnight. And his life had got really small. He was saying his family, his kids were always saying, come on, Daddy, come with us to this thing or that thing. And he was saying, no. Part of that was he was afraid to exert himself, because he didn't like it, the feeling of when his heart would go faster, because he didn't want to have another heart attack. But also a part of that was his social story about who he was, that identity of this big, strong man that can do anything, go anywhere, tackle any problem. He felt that man was gone, and what was left was a shell. That's how he described it to me. I'm not the man I used to be, and I don't want anybody to see me like this. So that meant that his life became so small. He was staying in the house essentially, and he'd kind of given up on everything. So what we tried to do was really help him connect with his values. And for him, his relationships were everything. His family was everything. So it was okay. Well, what are you doing? What are you doing? What are your behaviours telling you about? Well, I'm not really doing anything anymore. I'm doing the bare minimum. Okay, well, what are the behaviours that you could do? You know, can you accept that there are lots of different versions of you, and that the old self, yeah, you know, would like to go back there. It probably wasn't a perfect. And yourself now, it doesn't mean that there's nothing to you anymore, just because you can't walk the dog and you have to stop every 5 minutes. You know, relationships are important to you. Being a good dad is important, good husband. What are the things that you can do now? He says, well, the fact that I'm not in work means that I actually do spend a lot more time with my kids and I'm able to help them with their homework. You know, my wife has to go to work. I don't like that because I was the breadwinner, but can't do much about that at the moment. So I'm going to, when she's at work, I'm going to make sure the house is clean. I'm going to power hose the outside. I'm going to have the dinner on. You know, he was able to begin to live again and do the things that matter to him. Now, they were different. They had to change. So he couldn't walk up and down the mountain with his son anymore, but he could sit and do his homework with him.
Yeah, it sounds like without isolating his values, you wouldn't have really had a way in.
Yes. Yeah. And I never sat and did an exercise with him to ask him about values. That just came up in all the conversations that we had. What's the most important thing to you? And he said, my family, my kids is everything to me. So if we get hooked into the story of who we are, it can become a bit of a cage.
Mm-hmm.
Do you get where I'm
going? Yeah. I've seen this with people, and for some reason, two particular patients who was severely affected by long COVID, having previously been very fit people and ravaged by the first wave of COVID, and not being able to connect this breathless, fatigued version of themselves with the story of I'm a fit person, I do the marathons, that is who I am. And I don't know how either of those people are doing now, but this toolkit would have been very useful for me then, to at least have signposted them to something that people can use to try and build a new story, I guess. I sometimes talk about chapters of a book, and that each chapter will have its ups and downs, and sometimes you do have to turn the page.
Or versions,
and move into the next chapter.
like Word. You know, there'll be the first version 1.0, and then there'll be 1.2, 1.3. You know, they'll be debugging things and making it better. You know, we're the same. The version of me now at 50 years old is very different from the 20-year-old me. You know, good and bad. There's a lot of people popping into my head as we're talking. Just to give you another example, if that's helpful, you know, another man in his 50s had this condition that caused extreme fatigue. He had to give up work. He had to go for naps during the day when they went on holiday. You know, he couldn't go out and enjoy himself with his family. He would have to have a 3-hour nap every day, or sometimes more than that. You know, he always wanted to teach his son how to climb a mountain and light a fire, and, you know, that sort of camping scout kind of stuff. He couldn't do that.
Yeah, Bear Grylls.
Bear Grylls, yeah. He couldn't do that now. And this condition isn't, you know, I worked with him about a year into it, maybe a year and a half, and we were kind of hoping that things would get better and his energy would start to come back, and with the right treatment. And now we're realizing that's not happening. It's, you know, there'll be peaks and troughs, but he's probably not going to go back to the baseline level. So there was a lot of grieving in it for him, on this loss, this huge loss to who he was. And there was this question, why me? Like, I'm a burden now. What's my purpose? What am I going to do with the rest of my life? I can't get back to my old job. What am I going to do? So again, we talked about values, and we did some of those sit down proper exercises, and he went away and thought about it and brought me back a list, and we talked about it, you know. And again, relationships always comes up, you know. Family important to me, being a good dad, spending time with my kids, similar to that other person. You know, he was able to do that, you know, because he wasn't at work. He was spending more time helping his son with exam preparation, things like that. Instead of teaching him how to light a fire, he thought, well, another thing I could teach him is chess, you know, because there's no physical exertion there. he wasn't able to go back to his job, but he said, I want to volunteer. I want to test out what I can do. And, he's volunteering now. So he's kind of having to accept the adjustments, having to rest. And he'll have all these unhelpful thoughts like, you're just a malingerer. That person in the wheelchair has a real disability. You don't. Everybody's thinking you need to get back to work and you're just exaggerating things. So he was avoiding going out with friends. And then we tried to, diffusion, and noticed that I'm having the thought that what matters. And he began to kind of create a new life, very different to what he thought. But with the ACT skills, he was able to start living again, which is essentially what this is all about, really.
Yeah, because the ocean liner keeps moving forward, and we don't want people to get off. It's making peace with it and finding tools to help you do that. So some time ago, I read the book The Happiness Trap, which is by Russ Harris. And yes, so I think if anybody's interested in learning more about this type of therapy, that's a good place to start, I would say.
And it's a book, yeah. So it's not therapy, and it's not written for therapists. It's actually written for the public. So it's a really easy read, practical book, which I really like about it. And all the strategies we've talked about are in that, plus a lot more. Really recommend it. He's got a brilliant YouTube channel as well, where he's visually kind of created animations to explain some of the things that we've talked about. They're really good as well.
I'll put a link to that in the show notes so that anybody can find it easily without going into the rabbit hole of YouTube where everything's going to distract you one thing after another. Are there any other go-to resources that you would steer people towards to begin to explore this in a bit more depth?
Yep. So Russ Harris has a company that he's involved with called Contextual Consulting, and the ACT community all these bigwigs are very, very generous with their resources. So a lot of what they have is published online, so anybody can access them. All these strategies are there. It's really, really good of them. They're really good strategies. So if you look at contextual consulting, there's courses there for people, online courses as well. PsychWire is another one. Steve Hayes' book, A Liberated Mind, is also a good book, a bit harder to read than Russ Harris's. Russ Harris kind of has a way of simplifying things for the general public. Stephen Hayes' book is a wee bit more academic, but some people might like it. I always draw on, in my work, Ray Owen's book, Living with the Enemy, which is an ACT approach to chronic illness.
Okay, so Living with the Enemy. I'm going to look that up.
Yeah, by Ray Owen. He's a clinical psychologist in England. Really good, wee, short, easy to understand book. And he follows case studies throughout, so you can really practically, put the strategies into
the model
practice.
in action. Yeah.
Yeah. So those are all good places to start. The Happiness Trap is a brilliant book. I don't know how many copies I've bought about for friends, family. It's a life skill book.
Yeah. So expect to come back to it many times, I would say, because all of this is a process. It's not something that, like we've said, it's not a goal. You read the book and you're sorted. It's a process that you will come back to and get wrong and come back to again. And I think that's the story of life, isn't it, really?
And in Ray Owen's book at the end, he kind of puts it all together. I like this. So I kind of did this practice myself last night, preparing for this podcast today. So he says, if the value was, for me, it's physical and mental health, because I think without those things, you're snookered. Psychological well-being and health are pretty important. Yeah. You take your mind everywhere. You take it on holiday. You take it to bed. You take it to work. We can never get away from ourselves. We're always here. So it's important, as is physical health. So if those values were important to me, I would commit to the following. So carve out a bit of time to exercise 3 times a week in the service of staying fit, so that I can play with my kids for years to come, and hopefully grandchildren, and be able to lift big bags of soil and do gardening and things like that. So I am willing to experience thoughts such as, you're not going to stick to this, Ceara, it's too hard. If you go back to the gym now, people are going to laugh at you. Okay. And feelings such as embarrassment, tiredness, sore muscles, lack of motivation. I'm willing to do that if that's what it takes. So that's kind of it in a nutshell, isn't it, really, what we've talked about?
Yeah, absolutely. I think that's a fantastic way to draw a line under what we've talked about. It's wonderful. Thank you so much for being generous with your time.
My pleasure.
That was fantastic. I really hope people get value from this, and they're welcome to bring any questions to me, and I'll pester Ceara to answer them for you.
Yes, and give it a go. Like I said, it only is helpful if you actually take action and use the strategies. Knowing it really isn't enough.
Yeah.
You know,
Yeah.
but yeah.
Thank you. Thank you so much.
No problem. Thanks.
This has been a Monkey Pants Productions podcast.